Each year, circumcisions are done across the country on infant boys. It's considered a routine procedure, and you've likely heard the benefits. But do you know there are risks as severe as death? Now, we do want to warn you, some of the material in this story may be considered graphic. Circumcisions have been going on for thousands of years.
I was circumcised as a kid.
Ashland resident Kobe Johnson was circumcised as an infant, and Medford mother Dee Dee Morgan wanted all her sons circumcised too.
Want him to look like his dad.
So what's the big deal?
Babies actually die from circumcision relatively often.
Author and investigative journalist Jennifer Margulis tells us in less than the 40 minutes it takes to do a circumcision, everything can go wrong.
We think of circumcision as a routine operation, and in the majority of cases nothing goes wrong. But things can go wrong with circumcision, and unfortunately they go wrong more often than is reported in the medical literature.
She tells us each year 1,250,000 baby boys are circumcised. 117 die from complications related to the surgery.
A baby was circumcised in an American hospital in Sacramento. It turned out that he was a hemophiliac and he died of blood loss. The death from that circumcision will be listed as death from hemophilia.
Yes, there is. There is a risk of death. There's a lot of other risk factors also involved.
Dr. Taylor Drake walks us through the circumcision.
It is a painful procedure. You're removing the foreskin from the penis.
The baby's legs and sometimes arms are strapped into a circumstraint. While there, he's given a sugar water pacifier and a shot of lidocaine to numb the area.
The foreskin is being held between this device and the bell, and the head of the penis is right in here. Pull the foreskin up, and this is where the estimation of how much foreskin you need to take off comes in. And then you clamp this down, go all the way down as tight as you can. Then you use a scalpel and you cut the foreskin around this piece, and that's it.
She states removing foreskin involves estimation, and sometimes too much or too little skin can be removed, resulting in another risk, a botched surgery.
I did have a case a few years ago where the foreskin, so the baby was in between 2 and 3 weeks, which we like to do it before 2 weeks old, or else you have a lot of trouble with skin separation. This one was between 2 to 3 weeks, and the skin separated, and I had to put in 7 stitches.
In the last 4 years, she says she's also seen a partial circumcision. The outer layer of foreskin removed, the inner layer missed.
You can't redo it. It's a one-time deal.
Still, the American Academy of Pediatrics says evaluation of current evidence indicates that the health benefits of newborn male circumcision outweigh the risks. Their research shows uncircumcised boys have a 1 in 100 chance of developing a urinary tract infection in the first year, while circumcised infants only a 1 in 1,000 chance. Circumcision also lowers the risk of penile cancer and may reduce contraction of some sexually transmitted diseases up to 35%.
You look at the data. It looks like there are some things that it does reduce the incidence of, but there are things that are incredibly rare anyway.
There are religious, ethical, cultural, and medical reasons to circumcise. For Father Kobe Johnson, despite being circumcised himself, he decided not to circumcise his 4 boys.
The concern of, oh, I'm going to look different than my dad, or I'm going to look different than the other guys in the middle school shower, it doesn't really come up that much.
To him, medical benefits didn't outweigh the risks. Now, tomorrow, as we continue this story, the capitalization behind circumcisions. Hospitals and doctors can make big bucks off the procedure, especially since the foreskin doesn't always go out with the biohazard. Sometimes it's sold for a profit. We'll tell you what for tomorrow night on NBC5 News at 6. In studio, Jennifer Elliott, NBC5 News. Once a circumcision is done, the foreskin doesn't always go out in the biohazard. That leftover piece of skin has a lot of uses you may not know about. Now, we do want to warn you, some of the material in this story may be considered graphic.
Nice and tight.
Moneymaker.
There was some mutilation that took place because of the surgery.
Medford mother Dee Dee Morgan says she's heard of a child whose circumcision was done incorrectly.
That has lifelong repercussions. So
there's a lot of things that parents don't realize about circumcision. When they're deciding about it, they're not thinking about the fact that the doctor is going to be paid for the operation. If the circumcision is botched, you'll have to go to a pediatric urologist and you'll have to pay them as well.
Investigative journalist and author Jennifer Margulis says her research has found that circumcisions are big business for many hospitals and doctors.
A lot of things that are done to infants and even to pregnant women are done because people make money from them.
A single circumcision costs anywhere from $100 to $500. She says each year hospitals can make $1 million off the procedure. However, Dr. Taylor Drake says as a personal physician, she's not raking in the dough.
We do block out the hour in case there's complications, and during that time we could see, if we see a kid every 15 minutes, so basically it's a wash. I don't consider it a moneymaker.
But she does tell us not in Oregon, but in some parts of the country, the leftover foreskin is kept.
I trained in Iowa and we kept them.
Neonatal fibroblast is a code word for infant foreskins. So these foreskins are sold to use in the biomedical industry.
Margulis says each 6-inch piece of skin can be sold for as much as $2,000. Cells are harvested for use in high-end beauty products like the UK's Velvelta. It's also used in tissue grafts for burn and skin cancer victims and for research. In fact, you can purchase neonatal fibroblasts or foreskin cells for $399 per milliliter online.
I think that parents should be informed. You need to read the fine print when you sign a consent form.
Government data shows about 55 to 65% of U.S. males are circumcised, but in other countries,
it used to be that every British man was circumcised. A few years after 1948, when the British medical system became public, fewer than 5% now of British men are circumcised. So when you take the profit motive out of circumcision, doctors stop doing it.
The procedure, considered cosmetic by doctors, can reduce the risk of urinary tract infections, penile cancer, and sexually transmitted diseases. But risks, although rare, include infection, botched circumcisions, and even death.
Back when my oldest, was born, what you heard was that there was more risk for adult males to have problems, and it's harder to have it done as an adult. You might as well just do it as a baby.
So while Morgan wanted all her 4 sons to be circumcised, she does say you should know all the facts.
I think there's risk either way, but I think on both sides there's minimal risk. You just have to decide what you're willing to live with or not live with, or what you think your child would want.
A decision that either way lasts a lifetime. This topic can be considered very controversial. We bring you this story purely to inform. In studio, Jennifer Elliott, NBC5 News.